Hello, I'm Dr. Sina Reangber from LifeTime Smiles in Haymarket, Virginia, and I get a lot of questions about full mouth reconstruction. Full mouth reconstruction is actually when we have to restore all your teeth in your mouth. So it could be the top teeth, the bottom teeth, or a combination of both. So it could involve implants, it could be crowns, bridges, veneers, inlays, onlays. Basically, we're doing some type of restoration on every single tooth in your mouth. Candidates for full mouth reconstruction can be pretty much anyone. Basically, anyone who is missing teeth, broken teeth, have been struggling with gum disease, broken fillings, broken teeth. They're really candidates for full mouth reconstruction. It's really patients who are no longer in control of their teeth. They're just always battling, their teeth breaking, their gums getting inflamed, things like that. So there's different ways that we can treat their oral health by doing full mouth reconstruction. What some of the treatment options are for full mouth reconstruction, it really depends on the condition of your teeth that you have in your mouth right now. If the teeth are broken or have cavities, but the roots and the foundation is still good, then we can treat your teeth and do fillings, crowns, onlays, inlays, even bridges, things like that to help restore the teeth that you have. If the foundation of the teeth are not good anymore, you've got bone loss, you've got gum disease that's caused some of your teeth to be lost, or over the years you've had a tooth taken out here and there, then it may involve some of your teeth being restored, some of your teeth being replaced with implants. And in some cases, we actually have to remove all the teeth and restore them with dental implants to help get the function of your teeth back together. A general dentist being qualified to do full mouth reconstruction? And the answer is yes, some general dentists are very well capable of doing full mouth reconstruction. Now, they do take a lot of continuing education post dental school in order to be able to do these type of restorations. My recommendation is to check their credentials, ask the dentist that you're planning on seeing to show you before and afters of cases that they've done, what other postgraduate courses they've taken in order to be able to do a full mouth reconstruction. What the process is to do full mouth reconstruction. It all starts with coming in to see the dentist. So when you come in to see the dentist, we have to take a full set of x-rays, do a full comprehensive exam, review your medical history, dental history, and kind of get an idea of what your journey has been throughout your life in dentistry. We want to make sure that health-wise everything is okay, and then we come up with a plan of what we're going to do to help restore your teeth. If we are keeping your teeth, then we start with photos along with the x-rays. We take a 3D scan, we do mock-ups of your teeth. We can even do virtual simulations of how your teeth would look, how you would look talking and speaking with these new teeth. And then that way we can discuss what your likes are of the new design and things you want to change or you want to keep. Once we decide and confirm that that is what you want, then we go into the production process where we fabricate all the guides or templates that we need in order to be prepared for the day of treatment. Then you would come in on the day of treatment, and we can, depending on what we're doing, we can do one arch, we can do both arches. It just really depends on the full scope of what we're doing. So when patients are considering full mouth reconstruction, they want to know how long the process is. So there's a lot of pre-operative planning that is done behind the scenes. And when you're ready to get the treatment started, it could be a few hours if we're doing one arch. So it could be anywhere from 4 to 6 hours in one arch, either the top or the bottom. And it will involve getting anesthetized, preparing the teeth, getting a scan or impressions of the teeth, making temporaries that fit well, are sealed, are comfortable when you're biting. And then we get everything to our lab, work with our partners at the lab, and start making the restorations. While you are in temporaries, it really gives us a good idea of how you're chewing, how you're speaking with the temporaries. Do you like the shape? Do you like the size? Do you like the color? And that gives us a lot of insight because we will take that information and design your final restorations. So once you're happy with that, it takes about 3 weeks to get your final restorations completed. And then you come back and it could take about 2 hours to 3 hours to deliver the final restorations. What type of anesthetics or anesthesia is possible while patients are getting this treatment? Typically, in a general dental office, we always give local anesthetics. So that's going to be Novocaine as most people know it. Now, the other options are some patients have a little bit of anxiety with dental treatment, so we can give them some medication to kind of relax them, usually like a Valium to calm them down and just kind of relax them for the procedure. We can also do nitrous oxide. Some patient likes it, some don't, so it's really a personal preference. But for most patients, a Valium type of medication works really well to help them calm down. Some offices do provide general anesthesia or kind of a semi-general anesthesia where patients get an IV, and that is also an option. We do have the option of getting an anesthesiologist in our office to help provide that type of a procedure, but most patients do very well with just local anesthetic. How long is it going to take for them to heal after doing full mouth reconstruction? So it really depends on what type of reconstruction we're doing. If we are doing what most patients know as full arch implants, that's going to take a little bit longer because it is a more surgical procedure. That I have patients that do great the next day. I have patients that get a little bit of bruising and a little swelling, usually for about a week, and then things start healing. If we are doing just restoratively, just fillings, crowns, onlays, bridges, things like that, then usually in about 2 to 3 days, patients start feeling better. They may have a little soreness, a little aching just from keeping their mouth open or from us working in there, but usually it isn't something where they need to have multiple days taken off from work, maybe a day or two just to relax and just kind of let things heal. But after that, usually they do very well. What do patients need to do in terms of taking care of their teeth after a full mouth reconstruction? So full mouth reconstruction is a very important thing patients need to do to help get their teeth back in their mouth or get them restored. Now, what do they need to do after that is done? Well, we first need to see what happened in their natural teeth. Why did they lose their natural teeth? What caused their natural teeth to break down? What I find is a lot of times if they have gum disease or cavities, it's really, really important that we start making changes with their diet, with their habits, with their home care. I recommend patients who get full mouth reconstruction to come in and see us every 3 months so that we can help them maintain their new dentition. What we don't want is for patients to spend all this time, money, effort in getting their teeth restored, and then they're back to square one after a year because now they've got cavities, they've got problems around the implants, they've got infection around the implants because they didn't maintain it. It's really, really important to brush your teeth, floss every night. Start using a water pick right away because all those things are going to help maintain removing plaque and debris from around the teeth, but also getting in a better diet, not eating a lot of sweets or refined carbs or sodas. Sipping on soda all day is really bad for you, or sipping on even coffee throughout the day is really bad. Those are things that are going to just destroy the new work that's been placed in your mouth. So it's really, really important that we discuss home care and what we need to do to help maintain the new beautiful teeth you get. Will a full mouth reconstruction last the rest of my life? It can last the rest of your life if you take the proper precautions. But with that said, nothing really lasts our whole life. Our own dentition, which we're now needing to replace, didn't last your whole life. So will it last? It can, but it also may need some maintenance over time. Just like anything in life, it will need maintenance. So, getting an implant, it may have a problem 10 years down the road. Getting crowns, at some point, anything we put in your mouth will need to be redone at some point. How long that's going to last is really determined by how well you take care of it, your diet, your overall health, how much medications you're taking, is it causing dry mouth? There's so many factors that play in how a restoration is going to last in your mouth. And these are really, really important questions that we discuss with our patients. And if you're going to see someone for full mouth reconstruction, those are really good questions to ask them. Any financing options available when patients need full mouth reconstruction? Yes, we do have financing options available through third-party companies that we work with. So if you're interested, we'd be happy to discuss that. So if you have any further questions or would like to discuss a full mouth treatment option, please give us a call at 571-248-0700, and I'd be happy to discuss it with you.